In this lecture, we are going to discuss different aspects of the tetracycline. So let's get started. First of all, we will look at the structures of the tetracycline. Tetracycline has four important rings. Okay, if you see here, 1, 2, 3, 4. So that's why we call the tetracyclines mean four cyclic structure present in it. Okay. And next we will see the presence of the R group. 1, 2, 3. There are three R groups present in the tetracycline. And we just make changes in these R group and you will see the different category of the tetracycline form. Okay. Next, we will look at the classification of the tetracycline. Basically, we categorize the tetracycline into the three generations on the basis of the origin or preparation. Okay. First generation, that is actually biosynthetic form of the tetracycline. You will see the tetracycline, chlortetracycline, oxytetracycline, demiclocycline. So here are basically the four most important tetracycline that actually fall in the first generation of the tetracycline. Okay. Next is the semi-synthetic form of the tetracycline, and that actually fall in the second generation of the tetracycline, in which you will see the doxycycline and the minocycline. These are basically the two most important and most commonly used clinically tetracycline. Next is the maclocycline, methacycline, limecycline, and the rolly tetracycline. So here are basically the different second generation tetracycline. And if we look at the third generation tetracycline, you will see the tetracycline, omadacycline, sericycline, irabacycline. So basically these first three are actually again semi-synthetic, and the irabacycline is actually totally synthetic in nature. So here are basically the three most important generation of the tetracycline. And if we look at the mechanism of the tetracycline, how tetracycline actually inhibit the growth of the bacteria. Okay, first of all, it will inhibit the translation process. That is most important in the synthesis of the protein. So basically, DNA actually form the RNA, and that process is actually called the transcription. Okay, next process, from the messenger RNA you will see the synthesis of the protein, and that process is actually called the translation process. First process is transcription, second process is the translation. It will play its role in the translation process. We will see how. Okay, first of all, we will look at the two most important subunits of the bacterial ribosome. So if you look here, bacterial ribosome has two units, 30S and the 50S ribosomal subunit. Okay, and in between them you will see the presence of the messenger RNA that will actually translate into the protein with the help of the ribosomes. Okay, so in that situation, at the 30S subunit, you will see the three most important site: EPA, EPA, E for exit site, P for peptidyl site, and A for amino-acyl site, or you can say acceptor site. Okay, so first of all, first transfer RNA having amino acid will attach at the peptidyl site. So if you see here, here is the transfer RNA, tRNA, having amino acid. Okay, basically this is the amino acid that actually attached to the tRNA, transfer RNA. First bind at the peptidyl site. Okay, next we will see the second transfer RNA having different amino acid. So here is the different amino acid attached to the tRNA, will bind to the A side, or you can say amino-acyl side. That is the normal process, and ultimately you will see the bond formation between the two different amino acids. But we will see how tetracycline play its role in the inhibition of the binding of the incoming tRNA at the A side. So first of all, you see, if I say here is the tetracycline, here is the tetracycline. Now there is a competition between the binding of the tetracycline and the tRNA at the A site. Tetracycline, if the tetracycline bind at the A site, then there is no binding site for the incoming tRNA. When there is no binding site of the tRNA, then there is no protein formation in that case. And ultimately, when there is no protein formation, there is no growth of the bacteria. So it means that tetracycline is specifically used in the inhibition of the growth of the bacteria instead of the killing of the bacteria. So that's why we call tetracycline as the bacteriostatic drug. This is actually bacteriostatic drug by inhibiting the synthesis of the protein, which is very much important in the division of the cell. So that is the important mechanism of the tetracycline that actually inhibit the binding of the tRNA at the A site. Okay, that's simple. Next, if we look at the resistance, how bacteria develop resistance against the tetracycline for its survival. First is the efflux pump. So if you see here, if I say here is the bacteria. So bacteria develop the efflux pump. It means that if I say tetracycline enter into the bacteria, and at the same time efflux pump expels the tetracycline outside. When there is not tetracycline in the bacteria, there is no effect of the tetracycline on the bacteria. So that is the important mechanism of the bacteria, how bacteria develop resistance against the tetracycline. Next is the enzymatic inactivation. So basically, bacteria can also develop the different enzymes. Here is the enzyme, and that enzyme is actually inactivate the tetracycline. After inactivations of the tetracycline, there will be no action of the tetracycline in that case. Next is the bacterial protein. Bacteria can also develop certain types of protein, okay, that actually prevent the binding of the tetracycline at the A site. That is the important thing. There are certain proteins that actually prevent the binding of the tetracycline at the A site. It means that when there is no binding of the tetracycline, then ultimately the incoming tRNA will obviously bind at the A site. So that is the important resistance mechanism of the bacteria. If we look at the antimicrobial spectrum, coverage of the tetracycline. So basically, tetracycline is used for the gram-positive bacteria, gram-negative bacteria, spirochete, mycoplasma, and the different atypical species. There are a lot of diseases that are actually caused by the different categories of the bacteria, like the peptic ulcer that is actually caused by the H. pylori, Lyme disease, Borrelia burgdorferi, and chlamydial infections, mycoplasma pneumoniae, Rocky Mountain spotted fever, and lot of diseases that actually caused by the different types of the bacteria. And these are the diseases that actually treated by the tetracycline. Okay. If we look at the pharmacokinetics, if the patient is taking the tetracycline, please give instruction to that patient that he or she will not take the tetracycline along with the substances having divalent or trivalent cations. But why? Divalent like the calcium, magnesium, trivalent aluminium, and if you say iron. So these substances can be present in the milk and the antacids. So basically these ions, divalent and trivalent cations that are actually present in the milk and the antacid will bind to the tetracycline. Okay, it means that you will see the complex formation. Cations along with the tetracycline. You will see the formations of the complex. And now this complex is unabsorbable in the GIT tract. So it means that when there is no absorption of the tetracycline, then there will be no effect of the tetracycline on the body. So that's why you should have to be careful about taking the tetracycline along with these food or the drink. That is the important thing. And you will also see the tetracycline deposit in the calcifying tissue of our body, like the bone and the teeth. because tetracycline binds to the calcium, and calcium is actually present in the bone and the teeth. And you can also see there are certain tumors having high content of the calcium, so tetracycline can also deposit on that tumors. So that is the important thing about that. And next you will see tetracycline can easily close the placenta. It means that tetracycline can deposit in the baby, and ultimately tetracycline will start depositing in the bones and the teeth of the baby. So that's why tetracycline is actually contraindicated in the pregnancy. Okay, and you can also see that the tetracycline is actually excreted by the kidney. So kidney function should be proper for the excretion of the tetracycline. If the kidney function is not proper, you will not give the tetracycline except one thing, doxycycline. Okay, important thing will be the doxycycline. Doxycycline is not eliminated by the kidney. It actually excreted in the feces through the bile. It will first of all excrete in the bile, and after that you will see it will be excreted in the feces. If we look at the different adverse effects, you will see the epigastric distress. Okay, first adverse effects will be the epigastric distress. That is actually caused by the irritations of the gastric mucosa, and you can also see the esophagitis in that case, inflammations of the esophagus. So that's why, to prevent the esophagitis, patients should take the tetracycline along with the drink or the food, except the dairy product, or capsule form is more preferable than the tablets. Okay, that is the important thing. And you will take the tetracycline on the empty stomach. Okay, and you can also see the disturbance of the normal flora by the tetracycline. If you see the disturbance of the normal GIT flora, then you will see the diarrhea, and you will also see the growth of the resistance bacteria in the GIT tract. And another important thing, you will see the suppression of the vaginal normal flora like the lactobacillus. When you see the inhibition of the lactobacillus, that is actually the normal flora of the vagina, you will see the increase in pH. Due to the increase in pH, Candida albicans, that is actually the fungi, start growing on the vagina and cause the vaginitis. Okay. You can also see the photosensitivity. Photosensitivity. Those patients who take the tetracycline can be affected by the sun, because in that case you will see the sunburns or the rashes on the skin. That is the important thing. Next you will see the depositions of the tetracycline in the bone and the teeth. Okay, and that cause the discoloration of the teeth. So that's why tetracycline is actually not given in the pregnancy or in breastfeeding state, or it will also not be given to the children less than 8 years of age. That is the important thing. Okay, and you can also see the vestibular dysfunction. Vestibular dysfunction, autotoxicity, in which you will see the dizziness, vertigo, motion sensation, and you can also tinnitus, ringing sensation in the ear. That is important thing about the tetracycline. And last you will see the hepatotoxicity. This is actually the rare thing and mostly happen in liver dysfunction. So that is the important thing about the adverse effects of the tetracycline. So this is all about the tetracycline. If you still have any question, you may ask in the comment section. Thank you so much.